Morning, everyone, and welcome to today's workshop's Pediatric Zero Suicide Webinar Series, Georgia Mental Health. I will now turn it over to Ms. Rachel Holloman. Ms. Rachel?
Thank you, Tara, and good afternoon. So let's get started. I am Rachel Holloman. I am the Interim Director of Suicide Prevention and Federal Grants for the Department of Behavioral Health and Developmental Disabilities. And part of that for me is actually overseeing this great team of people that you see here on the slide that all make up the suicide prevention efforts in the state of Georgia. I am also honored to be on a group of people that keep our state running in regards to our regional services for Georgia. And I'm very excited that you'll get to meet them as we go through today's webinar series. We have objectives. As you know, we are giving you credits for attending this in regards to your respective licensure needs. And so as per that, we do have our objectives listed here. I'm going to temporarily turn it over to Alicia so that we can move from there.
Thank you, Rachel. My name is Alicia Henderson, and I am the Youth Suicide Prevention Specialist here in our Suicide Prevention Program at the DBHDD State Office. I am going to dive into our state resources. So in Georgia, we do have a number of mental health resources. Some of these resources are available across the state of Georgia to all people, and some resources are specific to our DBHDD regions. I'm going to spend the next few minutes diving into the statewide resources that we offer. So our statewide resources can be broken down into crisis lines and warm lines. So our resources that provide support in a crisis. So if there's an emergency behavioral health situation or a crisis, these are resources that we can use to get immediate care or assistance. The first one that I will discuss is 988. By now, many of us have been introduced to or heard of 988. Starting in the summer of 2022, Georgia was able to call 988 to help with immediate mental health needs and to be connected to care 24 hours a day, 7 days a week, 365 days a year. So just like we call 911 for our medical emergencies, 988 is the number that we call for our behavioral health needs in a crisis and for behavioral health emergencies. Although we have introduced 988 and that has rolled out in Georgia for almost a year now, we are continuing to provide crisis services through our GCAL line. So GCAL, our Georgia Crisis and Access line. You may call GCAL at 1-800-715-4225 or text and chat through the My GCAL app. We do have the QR code here on the screen, and you can go ahead and scan that if you like, and this will take you to the store to download the My GCAL app. Our providers through our GCAL crisis line provide crisis intervention services. They dispatch mobile crisis teams. They assist individuals in finding open crisis or detox beds across the state of Georgia, and they link individuals with urgent appointment services. The other crisis resource that we offer is the Children's Advocacy Centers of Georgia. The Children's Advocacy Centers of Georgia is a hotline that you can call for child trafficking. So if you or someone that you know is experiencing sex trafficking, you can contact this line and they will get you connected to immediate resources for child and sex trafficking. So this just gives an overview of our 988 Suicide and Crisis Lifeline. The 988 law requires Georgia to enhance the current system's ability to respond to those experiencing a behavioral health crisis by providing someone to talk to, someone to respond, and a safe place for help. So when you call 988, you will reach someone 24/7, and that person will connect you to care immediately. These are peer-run warm lines, so you will get to speak to someone, and that person will be able to offer support right then and there, and then they will connect you to care if care is needed. And that can be mobile crisis. They coordinate with 911 and EMS as appropriate, and outpatient community provider response. And then lastly, a safe place for help. So these can include crisis stabilization units, crisis service centers, peer wellness respites, detox and substance use disorder treatment, inpatient beds, and outpatient crisis. Our other statewide resources can be considered warm resources. These are warm lines. These are not necessarily resources that you use when there's an immediate crisis or emergency. These are resources that you can contact for just additional support. So we do have the CARES warm line, And you can call or text them every day of the year from 8:30 a.m. to 11 p.m. And they do provide support for anyone experiencing a substance use disorder or anyone needing recovery or support related to that. The Trevor Project, this is not a Georgia-specific resource, but at this time we do not have a Georgia-specific hotline for LGBTQIA+. So this is a national resource that Georgia can also utilize. And you can call or text or chat for the Trevor Project. Our last WARM resource is the Georgia Mental Health Consumer Network. This is a peer-to-peer WARM line. They can be reached at 1-888-945-1414. This is a free 24/7 support for people living with behavioral health needs, recovering from trauma or loss, or who are experiencing life's challenges. So these WARM lines are numbers that you can just call if you need someone to talk to, if you need additional support, if you need some information on resources in your area, where to get help. That is what we would utilize our WARM lines for. And now I will pass it back to Rachel Holloman to go over our regional services and resources.
Thank you, Alicia. So DBHCD is divided into 6 regions, and in each region we have a regional field office. So we have 6 regional field offices, and each regional field office provides a comprehensive system of care to the people in that respective region. The regional field offices ensures that individuals are connected to care and resources, and we're going to let you hear from some of those great people today. And they also ensure that DBHC services are administered throughout the 6 regions in the state of Georgia. Next slide. DBHCD has provider tiers, which means that we have providers that we've divided into 3 respective categories. Our tier 1 are our comprehensive community providers. These are our community service boards, our safety net providers. They are going to offer core benefit packages and then also provide additional specialty services. Our tiers 2 are our community Medicaid providers, and these ensure choice for individuals receiving Medicaid and also offer core benefits. And then tier 3 is our specialty providers, and these are providers that provide any array of specialty treatment and support in the continuum of care for mental health. Next slide. Our comprehensive community providers, which are our community service boards. These community service boards, as you can see, are located on this map and highlighted for the areas that they serve. And they provide mental health, substance use, and intellectual disability services to individuals low income, no insurance, and or Medicaid or Medicare. Our community service boards serve children, adolescents, emerging adults, as well as adults. And each region, each of our 6 regions, contains at least one comprehensive community provider. Next slide. Our Georgia Apex program is something that is specific to our children and adolescents. The Georgia Apex program provides school-based mental health services for pre-K through 12th grade students. And it's a collaboration between community mental health providers and schools. There are Apex providers located in all 6 DBHCD regions. Our youth crisis stabilization units, also known as CSUs. These are crisis stabilization units that provide care to youth who need short-term acute stabilization of a behavioral health problem. We actually only have 4 in the state of Georgia. We have 1 located in Region 3, 1 located in Region 2, 1 located in Region 5, and 1 located in Region 6. And now I'm going to turn it over to Dr. Hedal Patel, who is our Region 1 RSA.
Thank you, Rachel, and good afternoon, everybody. Like Rachel said, I am, as you saw earlier, it was a blue corner of the state, and then the counties, that we serve are slide. We have 31 counties, that we serve, and each of this county has a mental health service for the people that we serve. So next slide, please. So in Region 1, these are our core providers, Aveda Community Partners, Douglas Community Service Board, Highland Brewers, and Bridge Health. These are our core providers, and core provider means, that they are responsible for serving our target population, which is individuals who have no insurance, individuals who have Medicaid, and individuals who are underinsured. That means, that people who do not have mental health services as part of their insurance coverage. These providers, because they are tier 1 and they have contracted with the state of Georgia, they are obligated to receive and evaluate. They do not have the luxury of saying no. People in private practice, they do have a choice of saying, who I want to serve and who I don't want to serve, but our providers do not have that option. So these are your safety net providers in Region 1. So Region 1 specialty and adolescent programs. One of the specialty services that serves Region 1 is the intensive family intervention. This is a really high intensive services. It's a team-based approach, which is designed for reducing recidivism, reducing school absentees, reducing crisis services, reducing any type of crisis or emergency room visits, and it is designed to keep family together. So this approach actually works with individual and it works with family. It provides counseling, it provides parenting, it provides crisis interventions. It just provides a whole heck of a lot of services under one. It's a team-based approach. And these are your providers. We have ACE community supports. We have, of course, Cornerstone, family mentors, and empowering youth are some of the providers that you may come across. There is one adolescent intensive residential treatment provider or program in Region 1. This is for individuals, who have addictive diseases, as part of their, mental health challenges. And we have 30 bed in Cobb County, 20 male, 10 female, and it is a residential, provider where individuals, can come between the ages of 13 and 17, and they are going to be receiving, 24/7, residential treatment, specifically geared towards recovery from the drug of choice, that they have been trying to recover or get sobriety from. In addition to all of the other services that I mentioned, we also have a wraparound. It's called wraparound services, but the technical terminology is intensive customized case coordination. You will also hear IC3 services. This is a community-based approach, making sure, that the services, that the individuals need to stabilize them are there connected, because many times, families are lost. They don't know, what to do, where to find resources. And many people who are coming into your offices feel just like we just don't know where to go. So the role of this provider is to help make those, connect those dots. Basically help hold somebody's hand and walk them through with all of the services that they need. And our provider for that is Bridge Health, which is the only provider that is delivering wraparound services, only tier 1 provider in Region 1 that is delivering the services. Rachel talked about Apex services earlier. And I want to say, that there's pretty much every county in Region 1 except 2 that does not have Apex services within the school system. Our providers are Aveda Community Partners, Bridge Health, Highland Rivers, and Georgia Hope. Individual can access, school-based services. The easiest way to access those services is through a school counselor. If you don't learn anything, this whole entire webinar, but please make sure, that you get your regional field office contact information. There are 6 of us. So please make sure, that you at least, get our names and numbers and phone numbers. So if you have any questions about, who do I go to, where do I find resources, what is available in my backyard, your regional offices are your point person who's going to be able to help you navigate through the entire system. Next. Okay, well, with that, I am going to kick it off to April, Region 2. Thank you all.
All right, good afternoon. It is afternoon, everyone. I am April Edwards. I am the Behavioral Health Regional Service Administrator for Region 2, and I have Ms. Kimberly Dempsey, my CYF Program Specialist here from Region 2. We cover the 33 counties on the eastern side of the state, and our counties are listed below that our providers do service. Next slide, please. So listed here are some of our providers. It's a mixture of our tier 1, tier 2, and tier 3 providers. We have CSB of Middle Georgia. That is our tier 1 provider. So as mentioned earlier, they are like our safety net providers, and listed there are the counties that they service. They provide core services, and they also do Apex in some of the schools in the counties that are listed there. This provider is actually split between 2 regions, so we kind of share this provider with another region, Region 5. But their clinics are listed here on the slide. We have Miracle House Incorporated for Bibb, Jones, Baldwin, and Putnam, and they provide our intensive family intervention services. So they are one of our specialty providers. So they're that tier 3 provider. We have River Edge that covers our Bibb County, Jones, Baldwin, Putnam, Monroe, Twiggs, and Wilkinson, and they provide those core services to our youth and families, as well as Apex. And they also do first episode psychosis for those individuals ages 16 to 30 years old. And they also operate our child and adolescent crisis stabilization unit for children ages 5 to 13. And those are the clinics they're listed there. We also have Care Partners, which is one of our tier 2 providers that provide core services. Serenity Behavioral Health is also our other CSB, which is our other safety net tier 1 provider for Columbia, Richmond, McDuffie, Lincoln, and Warren. Telfair and Wilkes County, they provide core and Apex as well. Still Waters Counseling is a core provider that services the counties listed on the slides. And then we have Transitional Family Services. They provide core as well as IFE. So they are like our tier 2, tier 3 provider. So again, IFE, we live in a world of acronyms here at DBHDD, but IFE again is Intensive Family Intervention Services. And then we have Lighthouse of Augusta. They provide statewide PRTF, which is our psychiatric residential treatment facilities for our youth and adolescents. So they are a provider for the entire state, but their main location is here in the Region 2 area. Next slide. We also have Oconee Center, which is also our tier 1 provider, so our safety net provider for Baldwin, Hancock, Jasper, Putnam, Washington, and Wilkes. So they provide those core services as well as Apex. Advantage Behavioral Health is also our tier 1 provider. So that's in that Clark, Athens area and those surrounding counties. And so they do core and Apex services. And they also have a clubhouse for our youth as well. We have Pathways that also services the Clark County area, and they are our tier 3 provider that provides those IFE services or intensive family intervention services. We also have the Social Empowerment Center, also out of the Clark County area in Jefferson and Barrow, that provide core services. Project Family, also that Clark County area that does core services. And we have Quality Care Advocacy Center for Richmond County that covers core and IFE services. Next slide, please. So as you see, we have a wealth of providers in our region that cross over different counties. But if you ever have any questions, feel free to reach out to our office. You do see there Kimberly Dempsey's information, as well as my information, as well as Carol Love, who is the Developmental Disability Regional Service Administrator. So they will cover any questions regarding now and comp waivers and other developmental disability questions that you may have. Did I leave anything out, Kim?
No, great job, April.
All right, next slide, please. And I will turn it over to Region 3.
Good afternoon. Thank you, April and Kim. My name is Olga Pittman. I'm the Children, Young Adults, and Family Program Specialist for our region. Our region cover just the 6 counties in the metro area, which is Caton, DeKalb, Fulton, Gwinnett, Newton, and Rockdale. Next slide. Our CSBs in our service, our catchment area are DeKalb CSB, Clayton Center, and Viewpoint Health. Next slide. And Fulton County is have their own contract with the DBHDD and the services that they provide, and they're be mindful of the of their highlighted area. They, like I say, they have their own contracted providers that they deal with. They have the North Fulton Service Center, which operates on Tuesdays and Thursdays from 9 to 7 p.m. They have their clubhouse for youth, which is Monday, Tuesdays, and Thursday, and their clubhouse specializes in substance abuse. They have the Adamsville Regional Health Center, which is open on Monday, Tuesdays, and Thursdays from 9 to 7, and they have appointments on Mondays. They run their children and adolescent services through their Oak Hill Child and Adolescent Center, which is the contracted provider for that center is Georgia Hope. And like I said, their SA Clubhouse is on DeLoe Drive, which is the Fulton County Clubhouse for youth. Next slide, please. Resources for Region 3 under Viewpoint Health. We have a crisis stabilization unit that's located in Decatur, Georgia, and they serve ages 14 to 17, and they have CSU, ASD, Autism Spectrum Disorder, CSU. It's actually in Conyers, Georgia, and they serve ages 10 to 14. They have the Zero Suicide Initiative throughout Newton and Rockdale counties. They have a combined coalition. We have Project Light, which is emerging adult, which is ran by Viewpoint Health. They have two teams, one that services DeKalb and one that services Fulton County. They have the clubhouses fall under Viewpoint Health umbrella, and they have Mixture, which is our prevention clubhouse. They have the Nest, and they have the Dreamers. They are the only one of our CSBs that service all three population: prevention, SA, and mental health resilience. And they have Strive Clubhouse as well, which is located in Covington and Newton County. And Chris 180, they serve as a drop-in center. So they have a special population that they target, which is our LGBTQ plus and the homeless population. They have several programs under their umbrella to include support employment skills, as well as linking to driver's ed and being able to obtain driver's license. And they run a food bank as well. And we have Vox Atlanta, which is a hands-on, youth-friendly provider that service an array from the arts, just all of the arts until engaging them in media, mass media production. Next slide, please. And we have our family service. We have family service organizations in Region 3. One is Favor, which is Families Advocating for Voices of Resilience. That's with Ms. Carmen Coates. We have Integrated Concepts for Family, which is serviced out of our South Fulton area. That's with Dr. Keisha Whitfield. And we have DeKalb Families in Actions, which serves our Decatur area, and that's with Ms. Tammy Harrison. And of course, we have Georgia Parent Support Network, which also houses our certifications for our certified peer specialists, both parent and youth. And then we have Grandma's Hands Outreach. These providers serves as a support group for grandparents and kinship raising grandchildren in their custody. We have two PRTFs, our psychiatric residential treatment facilities that's in our area. That is Laura Heights, which is located in Atlanta, as well as Hillside, which is in Atlanta. I see three providers in for our region is Viewpoint Health and Bridge Health. And we have the Intensive Family Interventions, which is serviced by our providers in our region. LIPT, the local interagency planning team we have one in all 6 of our counties. Our APEX are embedded in our schools through our community service board. as well as the SOC System of Care and the Supportive Employment and Education programs fall under our CSBs. Next slide, please. How to locate our providers. Because of course, we only have 6 regions, but our provider pool is very large, and it was too large to present on slides at this time. So we've given you a link here as to how you can connect with providers. If you would join that link, put in the information, location, and also you can also narrow it down as to a radius of how many miles are within your zip code area. This will give you a huge array of providers. And like I say, it can be narrowed down to a certain area within your residence. Next slide. As mentioned earlier, please remember your Region 3 field contacts, and that's for the behavioral health side. That would be Olga Pittman, myself as the CYR program specialist, which will deal with all your children and adolescents and young adults need. Our regional service administrator is Ms. Gwen Craddock, which is an operator of the chief of our office here on the behavioral health side. Please know that, as mentioned earlier, that the DD side, development and disability side, it handles your now and comp waiver. That is a different discipline from the behavioral health side, and that contact person is Ms. Vivica Black for the DBD Regional Service Administrator, and as well the intake and evaluations, which is a starting point for development and disability service. We have provided that phone number as well. Thank you for the opportunity to share the resources for Region 3. And next slide, I will pass it to Region 4. Jimmy.
Good afternoon. My name is Jimmy Bennett. I'm the Region 4 area of down here in Southwest Georgia. Our counties we serve run from Ben Hill up in the northeast down to the state line there at Lanier and across to the Alabama state lines. 24 counties here in Southwest Georgia include the cities of Albany, Bainbridge, Thomasville, Tifton, and Valdosta. Next slide, please. These are our Region 4 children, youth, and families providers. There are our 3 core providers, the Albany Area Community Service Board, or ASPIRE, Behavioral Health Services of South Georgia, or Legacy, as they are known, and Georgia Pines Community Service Board, along with their locations there. We also have several Tier 2 and specialty providers that are shown on here as well. Next slide, please. These are the CYF Children, Youth, and Family Services available in Region 4, similar to what's available in other areas of the state. Different providers have different services available, so I would encourage you, if you're seeking a specific service or you identify a family or a child with a specific need, that you can reach out to my office and speak to either myself or Todd Jones, who is our CYF program specialist here in the Region 4 field office. Next slide, please. There is our contact information for Mr. Jones, for myself, and for Timothy Hester. It's been noted before. He is the Regional Services Administrator for Developmental Disabilities, which is a different discipline, has to do with the now and comp waivers, but you can contact his office for those concerns. Thank you very much. And again, if you have any questions or any concerns, feel free to contact me.
Good afternoon, everyone. I'm Giovanna Daniels, Children, Young Adults, and Families Program Specialist for Region 5, which covers the southeastern part of Georgia. Our counties go from Ackland all the way to Wheeler and Wilcox, including the Middle Georgia area, the coastal counties, down to the Florida border. Next slide, please. As previously mentioned, we have 4 community service boards, or our safety nets, in Region 5. They include CSB of Middle Georgia, which covers Bleckley, Dodge, Johnson, Lawrence, Montgomery, Pulaski, Telfair, Troutland, Wheeler, and Wilcox. We have Gateway Community Service Board, which covers our coastal counties, from Chatham to Bryan to Camden, Liberty Long, Glenn, Effingham, and McIntosh. We have Pineland that covers Ackland, Bullock, Candler, Evans, Jeff Davis, Tatnall, Toombs, and Wayne counties. And last but not least, we have Unison Behavioral Health, which covers Atkinson, Bacon, Brantley, Charlton, Clinch, Coffee, Pierce, and Ware counties. Next slide, please. Some of the services that are available in Region 5, and this is not all inclusive because we do have additional services and supports through our various partners in the communities, whether it be the school systems, Department of Juvenile Justice, or our juvenile courts. But those who are contracted with our system include core services, and those are provided by our community service boards, as well as several other providers such as Access Mental Health, Melinda Graham and Associates, Georgia Healthcare Partners. We also have intensive family intervention services. These services are not available in every county. However, they are available in Chatham County, Liberty County, Glenn County, and Camden County at this time. We have intensive, customized, and moderate care coordination services, or IC3 and MC3. Those are currently provided by Community Service Board of Middle Georgia, and Viewpoint Health has Liberty County and serves out GNET schools. We have mental health resiliency clubhouses in Middle Georgia, the SOAR Clubhouse, which is located in Dublin, and we have the Spark and Roots clubhouses that are operated by Unison in the Waycross area. We also have 2 substance use disorder clubhouses, one operated by Gateway and the other by Pineland. The one operated by Gateway is in Savannah. The one operated by Pineland is in Statesboro, Georgia. We also offer supported education and supported employment services. We have a first episode psychosis program that is currently provided by Gateway, and it's called Strive for individuals ages 16 to 30. We have Apex in almost every county, but it is offered by every CSB we have, as well as Care Partners serves 2 counties with Apex services as well. We have 1 crisis stabilization unit in Region 5, that's Lakeside Crisis Stabilization Unit in Bloomingdale, and it's operated by Gateway. They accept youth ages 5 to 17. We have 1 psychiatric residential treatment facility located in Savannah in Region 5, and that is Coastal Harbor Treatment Center. Next slide, please. For additional information on available services, I have listed the 4 CSBs, the services they provide, as well as Care Partners, which is our additional non-CSB Apex service provider for Candler and Bullock County. Also, their contact information if you want to contact them regarding additional services that are available for our child and adolescent and emerging adult populations. Next slide, please. Additional resources we have in Region 5 for our families and also the community include Stronger Together Parent Support Network, Standing Tall, Dad Support Network for fathers caring for youth with mental health needs, Raising 2 Generations, which is the grandparent support group. We have Straight Outta Dublin, which is a youth move support network. And then we have 3 other support resources that are coming online and will be available this month, with a Hispanic family support group, a Wheeler County Parent Cafe, as well as Dodge County Parent Cafe. And again, all of the contact information for the chairs or directors of those programs are listed. Next slide, please. These are some additional programs that we have in the area through our safety and resilience programs, applied suicide intervention skills training, Safe Talk, Suicide Talk, Question, Persuade, and Refer training, suicide safety and resilience training, mindful self-compassion, trauma-sensitive yoga, Front Porch X, which utilizes an evidence-based curriculum called Trauma Drama, and community resiliency model training. All of these services are not just available in Region 5, but some of them are also available through Resilient Georgia. So you can contact your local person for Resilient Georgia, or the person that's in your region that may be able to connect you to some of these trainings. We also have here in the Region 5 office a QPR certified instructor, as well as mental health first aid. For more information about our community safety and resilience programs, I have listed the point of contact, Ms. Salisburn, at the end of the slide, and she will be more than happy to connect you to trainings. Trainings are offered every month. Next slide, please. If you have any questions about additional services, because as I mentioned, that list was not the entire list of providers in Region 5. If you have any questions also about our supports through the local interagency planning teams, which is care coordination and supports resources for youth and families with behavioral health needs or substance use disorders, please feel free to reach out to our office. We have our office contacts there. I am for the children, young adults, and families. We have Mr. Lopez as the Regional Services Administrator, and any developmental disability questions, now and comp waiver related questions, you have Ms. Pullen's contact information there as well. Thank you. Turning it over to Region 6.
Good afternoon. I am Ann Riley, and I am the Behavioral Health Regional Service Administrator for Region 6. And we cover the West Central Georgia area of the state. The 31 counties are listed there, but if we go as north as about Noonan over to Peachtree City, and then down past Upson County to all the way to Warner Robins. Down our southernmost county is Clay. I'm sorry. It is it's down where Stewart and Crisp County. I'm sorry. So down to Crisp County, and then back up to bordering on the Alabama. So our most west is Columbus. Next slide. We have for children and adolescents, we have 4 community service boards. And those are listed with their intake number and what counties they serve, so that you could contact them directly. You can also contact my office, which the information will be provided shortly. Next slide. Similar to the other 5 regions you've heard from already, we have some child and adolescent specialty programs that are provided by our community service board. APEX being the school-based mental health are in most of the counties in Region 6. Child and adolescent mental health clubhouses, we have 2, and those are with McIntosh Trail Community Service Board and Middle Flint, and theirs is called Beautiful Minds, and their ages are listed on the slide as well. We have child and adolescent substance abuse program offered by New Horizons, and that is in Muskogee County, ages 13 to 17, and it's called Project Change. We have the early episodes of psychosis intervention. We have 2 of those. New Horizons Emerge program, and that is in Muskogee and surrounding areas, and then Rivers Edge in Tune, and they serve ages 16 to 30. And for Rivers Edge, the Intune counties they serve are Crawford, Houston, and Peach. emerging adult support, and that program is also offered by New Horizons. It's called Generation Next. And then we have that program as well with Pathway Center, and that's up in the Noonan, LaGrange, Carrollton area. And that program serves individuals 16 years of age to 26. So that transition period of going from an adult to adolescent to a young adult. Next slide. The Region 6 field office contacts are listed. Jackie Ezel is our child, young adult, and families program specialist, and there's her email address. My information is there. You can call my cell phone or email me. It's the best way because we're on the road a lot. And again, like the other regions, Division of Developmental Disabilities, Valona Baldwin, and her email is there as well.
Thank you, Anne, and thank you to our panel of regional experts and presenters. We greatly appreciate this, and we just wanted you to give a brief overview of everything that we have available. One thing I do want to leave you with is our suicide prevention website that we do for the state of Georgia. This website is all things suicide prevention. It's preventsuicidega.org. It's where you will not only later be able to access these webinars, but also access all of our resources, all of our materials that can be downloaded and printed, any PSAs, trainings, events, anything we got coming up, anything and everything in the state of Georgia that DVHCD is doing for suicide prevention will be on this website. And so it's a one-stop shop for all things suicide prevention. And Alicia, I think I said my piece, so I'll turn it over to you.
Thank you, Rachel. So now we do have a couple minutes left that we can use for Q&A. I do know there were a couple of questions pasted in the chat. I do see that some of those questions were answered, but you can now come off of mute or put your questions that you may have in the chat for any of the presenters for our webinar today.
One of the question was basically, I read that if an individual is in your county and doesn't have that services, can that person get services, with outside of county or whatever? So an example would be if a young person, like in Region 1, we do not have any crisis stabilization units, right? Most of them are on South. So if an individual is in need of crisis, all of the crisis services are accessed by calling the Georgia Crisis and Access Line or 988. And when a person is deemed in need of inpatient services, there is a process in place for that youth to get inpatient services in Region 2 or Region 5, wherever those CSUs are located. So yes, if an individual is in need of services and if the service is statewide, that person is going to get services. Now, in terms of core services, 100% of the county, 159 counties offer some type of mental health services within that county. So get with your regional coordinators, look, good Lord, RSS, ARIA, CYF specialist, and they will be able to help guide, what needs to happen. It may mean, talking through a case and see, what sometimes we may need to piece, services together. But if you don't know what is there, and if you're not asking those, sometimes you don't know what questions to ask. So definitely pull us in. We should be able to help you, with those complex questions that you may have and guide a person in the right direction.
Thank you, Dr. Patel, for that. I do see two other questions. The other questions were, what is the best way to access assistance for voluntary CSU for suicide ideation and attempts?
So for volunteer or non-volunteer, if there is a CSU, crisis stabilization unit, within their catchment area, then that's probably where they would need to go. Other people end up going to the local emergency room, when they have a youth who has mental health crisis and the parents just don't know what to do. So there are 3 ways people can get into our crisis services. One, it is walking into our crisis, stabilization unit, which, happens, doesn't happen. The most preferred method is calling GCAL. The second is walking into a CSU. Third is by emergency rooms. And other RSs, if I missed said that, please let me know. Feel free to correct me.
Remember, we can use 98. We don't have to dial the 10 digits anymore. 98 will take the call straight to GCAL call center.
Thank you, Jose, for the 988 reference. Yes, I forgot.
No problem.
Okay, and the next question, we would like to understand what inpatient services for adolescent substance use might be available for parents to access. So what resources are available for parents for inpatient services for an adolescent with substance use challenges?
So for Region 1, I had shared that slide. We have a 30-bed residential program in Cobb County. And the information was on the slide. So if you have any specific questions, please feel free to reach out to me, and I'll be able to guide you in Region 1.
Thank you.
And Alicia, we'll put these slides with this recording on our website, preventsuicidega.org, because I know that's one of the questions. And then that way you will have the contact information for your respective region, as well as the information shared today.
Thank you, Rachel. Okay, well, if there aren't any other questions, I do want to just additionally add that you can contact any of the presenters that you saw here today in their regions with their contact information. You can also contact the Suicide Prevention Program, as Rachel stated, at our preventsuicidega.org website. If you want just additional information, you can also go to the DBHDD website and access some very detailed information about our state resources and regional services as well. And if you have any questions related to the training itself or feedback for the training itself, you can reach out to DBHDD Learning. This is the emails that you are receiving on how to join the WebEx today. I also want to add that you will receive an evaluation after this webinar. Although we are not providing CME or CNE or CEUs for this webinar, you can take the certificate that you receive and submit that to whichever agency you like to receive credit for the training here today. So the evaluation that you will receive tomorrow, that will be a short evaluation survey. If you could complete that survey, as well as the survey that will come later from our DBHDD Learning Department. Both of those surveys are required to be completed in order to receive the certificate of attendance for today. Thank you so much for joining this afternoon, and have a great rest of the day.
Thank you.